Have you ever wondered how medications like loop diuretics work to handle conditions like heart failure, edema, and hypertension? Grab your notes and let's learn the mechanism of action of loop diuretics. The site of action of loop diuretics is the thick ascending limb of the loop of Henle, which is a specialized section of the nephron. The lumen of the renal tubule contains the filtrate, and anything that remains in it by the end of the tubular system will become urine, while anything in the interstitium surrounding the renal tubules can be reabsorbed into the bloodstream depending on the body's need. Normally, sodium enters the thick ascending limb cells through the sodium-potassium chloride cotransporter, located on the apical membrane. This transporter moves one sodium ion, one potassium ion, and two chloride ions from the tubular lumen into the cell. On the basolateral membrane, the sodium-potassium ATPase pump is the primary pathway for sodium to exit the thick ascending limb cells and enter the bloodstream. Potassium ions brought into the cell by sodium-potassium chloride cotransporter and sodium-potassium ATPase pump are transported back into the lumen through potassium channels on the apical membrane. The positive charge in the lumen caused by potassium recycling promotes the paracellular reabsorption of positively charged ions, including sodium, magnesium, and calcium. So, what about the mechanism of action of loop diuretics? Loop diuretics actually inhibit the sodium-potassium chloride cotransporter at the apical membrane. By inhibiting this transporter, the loop diuretics reduce the reabsorption of sodium chloride. That's why it's helpful in managing patients with heart failure and edema because they reduce blood volume. But be careful, because when loop diuretics reduce the reabsorption of sodium chloride, they also diminish the lumen positive potential that comes from potassium recycling. This positive potential normally drives divalent cation reabsorption in the thick ascending loop of Henle. And by reducing this potential, loop diuretics cause an increase in magnesium and calcium excretion. I hope you understand the mechanism of action of loop diuretics and the reason for hypocalcemia and hypomagnesemia that can happen with prolonged use of loop diuretics. Thanks for watching.